Welcome to our video on the Prenatal Fetal Assessment. Let's get started. Here's a list of the elements of the Prenatal Fetal Assessment. So let's start with the non-stress test. A non-stress test is an external fetal heart rate monitoring for 20 to 40 minutes. A normal result is considered equal to or greater than 2 heart rate accelerations within 20 minutes, each rising by equal to or greater than 15 beats per minute, and each one lasting greater than or equal to 15 seconds. That would be called a reactive non-stress test. So that's normal. Abnormal is if during that 20 minutes, you get less than 2 accelerations, which you'd actually call non-reactive. It's also abnormal if there's a recurrent variable or there's late decelerations. So here's a normal non-stress test. So there's actually more than 2 accelerations, each rising by equal to or greater than 15 beats per minute, and they last for equal to or greater than 15 seconds. So it meets that cutoff. Again, 2 accelerations, greater than 15 beats per minute, greater than 15 seconds. And again, you want that because that indicates that the body or the fetus is reacting normally. So it's a reactive non-stress test. Now let's move on to a biophysical profile. So this BPP consists of 5 criteria. The maximal score per each criterion is 2 points, and a minimal score is 0. So you're going to assign them a 0, 1, or a 2. So a max score for a BPP is 10 because there's 5 criteria. So let's talk about the first criterion of a BPP. This is actually a non-stress test. So you perform the non-stress test, and if it's reactive, then the patient gets 2 points. And again, that's good. A high score is good. This isn't golf. You want a high BPP. However, if it's non-reactive, then the fetus gets 0 points. Now, the second criterion is the amniotic fluid volume. So when this volume is evaluated, if the deepest pocket of amniotic fluid is greater than or equal to 2 centimeters deep, then the fetus gets 2 points, indicating there's a good amount of amniotic fluid surrounding the fetus. However, if the deepest pocket is less than 2 centimeters deep, the fetus gets 0 points. The third criterion is movement. If the baby performs 3 or more body movements, then she gets 2 points. And if there are less than 3 or no movements, the fetus gets 0 points. Okay, so far you've done the non-stress test. You're basically just seeing how reactive the fetus is. You've looked at the amniotic fluid and you've looked at movement. The fourth criterion is breathing. If the fetus takes 1 or more breaths lasting 30 seconds or more, then the fetus gets 2 points. And that makes sense. You'd want there to be breathing. So if there's no breathing, then the fetus gets 0 points. And finally, the last criterion is the fetal tone. If the fetus performs 1 or more spinal or extremity extension movements, then the fetus gets 2 points. It shows you that the fetus is moving well, that it can move. But if there's no extension, then the fetus gets 0 points. So a total BPP score of 8 to 10 is normal, indicating that it's got enough fluid volume, it's reactive, it's breathing, it's moving, and it's got good tone. So 8 to 10, good. 6, however, is equivocal, but then definitely a 0, 2, or a 4 are considered abnormal. So let's do a question to apply what we've discussed so far. A 26-year-old female comes to the physician at 30 weeks of gestation for a routine prenatal exam. The non-stress test is reactive. Ultrasound shows the deepest amniotic fluid pocket of 4 centimeters, 4 fetal movements, 2 fetal breaths, each lasting 40 seconds, and no spinal or extremity extension. What is this patient's biophysical profile score? Feel free to pause this video while you think about the answer. Okay, so let's calculate this biophysical profile. So the non-stress test is reactive, and that's worth 2 points. So you give the fetus 2 points there. And then what's the amniotic fluid like? Well, the deepest pocket is 4 centimeters. And remember, the deepest pocket just needs to be 2 or more centimeters. So the fetus gets 2 points there. But what about fetal movements? The fetus moved 4 times, and the fetus only needed to move 3 or more times. So it met that criteria as well. So it earned those 2 points. Next is breathing. How many breaths? 2 breaths, each lasting 40 seconds. So that's adequate. So 2 points there. But what about tone? Well, there wasn't any spinal or extremity extension. So 0 points earned there. So if you add all of this up, the BPP score is 8. So that's normal. Remember, 8 to 10 is good. That's normal. Let's continue with the contraction stress test. The contraction stress test checks if the fetus can tolerate stress of labor. So in this test, you'll monitor the fetal heart rate during spontaneous or induced uterine contractions. So a normal result is basically the absence of any variable or late decelerations. Remember when we mentioned the non-stress test, an abnormal result means there was presence of variable or late decelerations. So in this instance, with the contraction stress test, then an abnormal result is considered if there is presence of late decelerations. But the actual parameter is if those late decelerations happen over 50% of the time. So you're inducing a contraction or there's a spontaneous contraction, and let's say there's 12 of those contractions. If there are 5 late decelerations for all 12 of those, that's 5 out of 12, which is less than 50%. So it wouldn't really reach this abnormal result. So again, if it happens with half of the contractions, then it's abnormal. But let's talk about what these early and late decelerations look like. So on the left image, you can see a decline in fetal heart rate. And this occurs at the peak of the uterine contraction. This is consistent with early deceleration caused by head compression. And that's usually just considered a benign finding. Now on the right image, you see a decline in fetal heart rate right after the uterine contraction ends. So this is a classic description visually here of late deceleration caused by placental insufficiency. Now, late deceleration on contraction stress testing indicates that the fetus is really not going to tolerate the stress of labor. We will now review Doppler sonography of the umbilical artery. This test assesses velocity and direction of umbilical artery blood flow. A normal result is a forward end diastolic blood flow, while an abnormal result is decreased, absent, or even reversed blood flow. And that actually indicates imminent fetal demise. So that's a very bad sign. You don't want to see that. What you want is forward end diastolic blood flow. So let's make sense of this. Here we see an umbilical artery Doppler ultrasonography. And you can notice that at the bottom, we have the umbilical artery blood flow. So let's explain this. Those upward spikes indicate the systolic blood flow, while those downward spikes indicate reversed end diastolic blood flow. And that's not good. So reversed end diastolic blood flow, and when you see this, it can indicate that you need to deliver the fetus quickly. Okay, now let's talk about percutaneous umbilical cord blood sampling, or PUBS. Now, PUBS is a procedure which involves inserting a needle into the umbilical cord percutaneously, and then you take a sample of the umbilical venous blood. So PUBS can detect low fetal hemoglobin or increased serum bilirubin. So it can be used to diagnose things such as erythroblastosis fetalis, especially if there's a high index of suspicion. You wouldn't just go doing this type of invasive percutaneous umbilical cord sampling unless you had a high suspicion. But while we're on that idea, what is erythroblastosis fetalis? So this is actually also known as hemolytic disease of the newborn. And this hemolytic anemia can be due to an ABO or RH incompatibility between the mother and the fetus. So if you know that, for example, the mother is RH negative and this is her second child and the previous child was RH positive, then you might be thinking that with this current pregnancy, she might have antibodies against the fetal blood. So that could raise your index of suspicion. So now the same type of procedure where you're trying to get to the umbilical cord blood can actually be used to transfuse blood. So if you find that the fetus is anemic, you can transfuse it and give more blood to the fetus. Okay, last, let's talk about fetal lung maturity testing. Now, the most commonly used test is lecithin to sphingomyelin ratio, and you determine this in the amniotic fluid. So you really get a ratio from this. So you can get from 2 to 3, and that indicates that the lungs are mature. So if you get a ratio of 2 to 3, that's high. So what is high exactly? It's the lecithin. Think of that numerator. So you have more lecithin, which indicates maturity. But if it's lower than that, then you get a score from like 1 to 2, for example, then you call that transitional maturity. And if the ratio is even lower than that, or less lecithin, then it would indicate that the lungs are immature. So there's actually a high risk for neonatal respiratory distress syndrome, also known as NRDS. Other less commonly used tests are surfactant to albumin ratio. That, again, is in the amniotic fluid. And you can also use the foam stability index. But the best thing to think about is really this lecithin to sphingomyelin ratio. And that concludes our lecture on these prenatal fetal tests.